recognizing youth and strategies for recognizing youth in distress in educational settings. You all know me, Melissa Heatley. I direct the Expanded School Mental Health Initiatives. And we know, and you know, because you've been experiencing this firsthand, that we are seeing a surge in mental health needs of teens with behavioral health challenges. We've been seeing this rise from 2009 to 2019 with increases in sadness and hopelessness by 40%, increases in suicide attempts or seriously considering suicide attempts rising by 36%, and suicide rates among youth increasing by 57% from 2009 to 19. And then the pandemic hits. And since that time, we know that our depression, anxiety symptoms have doubled, with 25% of kids experiencing depressive symptoms and 20% experiencing anxiety symptoms. And we've also seen negative emotionality increasing. That has also a surge in suicidality, with more than 6,600 deaths by suicide in the 10 to 24 age group in 2020. ED visits for suicide attempts are 51% higher for teen girls and 4% higher than boys in 2019. And we've seen that reflected in our CPAP volumes and our inpatient volumes, and in a surge for demand for care from our services and services regionally. We know that there are risk factors that have contributed to this, like having mental health challenges before the pandemic or severe COVID-19 outbreaks. One of the things that we also know is that disruptions in routine and schools and not seeing friends or you as frontline providers of support for kids has really hit our kids hard, and even more so our kids who have experienced ACEs or are from at-risk backgrounds or higher risk backgrounds, like kids from the LGBTQ community or kids of color, or from families with financial instability or housing instability and food shortages. This data is a review for you guys because you're living it firsthand, but it's also really important data to be bringing to the boards of education and putting forth in our public conversation about kids, because it really anchors our conversation in the real youth mental health crisis that we are experiencing right now. To that end, we've been seeing some national recognition of this crisis. We've been saying since 2016 that our Finger Lakes mental health system is in a crisis of care. The Crisis of Care report was authored by the Greater Rochester Health Foundation in collaboration with the UR Medicine team, and that will be posted on our website, where we declared that the frontline providers were not resourced enough to be able to meet the needs of youth mental health in the Finger Lakes. Since that time, with the pandemic and increasing rates, we've also seen this move to a national level. In 2021, the American Academy of Pediatrics has declared a national emergency in child and adolescent mental health. And the Surgeon General promoted an advisory in 2021 highlighting an urgent need to address the nation's youth mental health crisis. Again, nothing that you guys don't know, and also really critical to promote when you're talking to funders, when you're talking to people who make important decisions about how to allocate resources within your schools. We know that there are challenges in recognizing kids who are in need of support. There's a lot of stigma around disclosing and discussing mental health challenges, although that's gone down, which may be one of the reasons that we're seeing higher rates. But we also know that externalizing and high-flying behaviors are a lot easier to see than internalizing difficulties like depression or anxiety maybe. And to that end, our frontline educators, who are often the ones who are being asked to recognize kids who are at risk and sending them to the counseling office, they may not always be aware that teens are developing mental health challenges. Ed Weekly also had a headline that was really provocative recently about the terrifying shortage of mental health providers and counselors in schools right now, which puts a higher volume of burden on the teams who are in the schools and makes it harder to preventatively identify kids who might be at risk of needing higher levels of support. So there's really this urgent need right now for easier and efficient methods of early identification, monitoring kids who do have concerns, assessing immediate risk of suicidality and self-harm. How do you talk to families about concerns and link families who have those concerns with resources? And then how do we actually implement this? Today, we're going to be talking about identification. Next time, Dr. Stiles will be talking about some of those resources for linking families and talking with families and implementation. But the core of what we're talking about here is screening tools to identify youth in distress. What is screening? Well, this is really a tool or a process in a population of students, and it could be a big population or a small one, to identify a specified student's strengths and needs. It can be used to identify students who are at risk for mental health or substance use concern. It can be used as a decisional aid when supporting kids in crisis. The population you choose can be really broad or it can be specific. So broad may be screening kids who are changing grades from middle school to high school. It could be specific, kids who are presenting with depression to the counseling office for suicidality. It's really up to your district to decide what that might be. But screening is distinct from mental health surveillance data, which is important, and that schools do that the Office of Mental Health always compiles some really fascinating data on with the Youth Risk Behavior Surveillance System and the Child Health and Education Mapping tools. But this is anonymous information and can be part of a broad needs assessment, but doesn't do a good job of linking individual kids to care. And so how do we use these good tools to better identify kids who are in need of support? We'll be talking about some really concrete tools today. And I have about 8 minutes left in this conversation. We'll give you guys some things that you can take back to your teams and consider, and some strategies for implementing those tools and following up with families. First thing you need to do when you're thinking about how do we better identify kids who are in distress early on is to have a team. And you guys have a team that is diverse and consists of administrators, staff. Having a community member and a student and a family member at the table can also be really important. One district that we supported in implementing screening did not include a family member in their team, and found that there was actually a lot of pushback in the community. And having more family members would have been helpful with that. Other districts that we've seen implement screening successfully have included family members and have been able to avoid a lot of pitfalls. We also really want to support with generating engagement and support. And you might gather input from different groups and strategize how your goals are fitting in with different initiatives. And also think about how are your students being identified for mental health services in your building, or for referrals, perhaps to our Ready or crisis intervention services, and to the community. And what would the implications be for service provision? What are your resources? You also need to have really clear goals in your screening initiatives. You want to know why you're screening, who you're screening, and what you want as an outcome of that. So we think about there's 3 different types of screening. One would be universal. You're going to screen all 6th grade students in one district for anxiety to inform who might benefit from support during transition to middle school. A targeted screening would be to screen 9th graders who are struggling with return to school after COVID closures for COVID-related traumatic stress, for example. And that may inform development or recruitment or implementation of an evidence-based group like CBITS or Bounce Back in your school system. You might also consider suicide risk screening. For example, screening students presenting to the counseling center with significant distress for risk of suicide, and use those results to make an intervention plan for that individual child. And each of these we'll talk through different strategies for doing as an example. For our Screening initiatives, the first step, that you're also going to want to identify your staffing, your resources, and your buy-in, who's able to support, what are community providers available in your building and in the region, and start small when you're starting a new project. One kid, one classroom, one grade, one school, to make sure that you have the right procedures in place if you do have a kid who scores positive. From there, you want to select an appropriate screening tool. One of the best tools that are available to our school systems is through the shapesystem.com. So I'm actually going to follow this link, and I'm going to share my other screen real quick as this loads up. And the SHAPE system is hosted by the National Center for School Mental Health. And once you develop an account, you'll be able to log in regularly. And within, you can see that I'm part of Fairport's team. I'm not going to show any data, Fairport, I promise. This is what it defaults me into. You have access to a screening and assessment library, which is a really rich inventory of free, low cost, and validated measures that have been utilized in school systems. You can sort by focus area. So for anxiety, or for resilience, or for trauma experiences, or substance use. And these link to guides for how to consider, guides to these screeners and things to consider when implementing. This is a free resource that is incredibly rich and is available to all educators in the school system. I want to highlight a couple of tools for teen mental health. When we're thinking about universal screening tools, the pediatric symptom checklist, the PSC 17 or 35, is one that is increasingly utilized in school systems as a tool developed to identify a really wide range of internalizing, externalizing social and emotional concerns with data-driven thresholds and cutoffs to identify kids who are likely struggling with a potential behavioral health concern. The patient health questionnaire is a screener for depression. So if you want to screen your students more specifically, the PHQ-9A has severity items for depression that's tailored to adolescents. And it really helps facilitate recognition and diagnosis of depressive disorders. It's been used in schools increasingly to better identify kids who are flying under the radar and might be good referrals to school mental health clinics that are available and other resources. You also want to have a follow-up procedure that you're following. And so this is one in our region that has been highlighted at the state level as when you find a student that is scoring positive, what do you do? Are they receiving tier 2 or tier 3 services? Do they have a school counselor? Do they have services outside of school? And tips for talking with parents. We'll talk more about follow-up next time. We also want to highlight the need for targeted screening tools for suicide risk. So we know that 25% of teachers have been approached by an at-risk student with concerns for depression or suicide. We also know that 80% of school shooters have a history of suicidal thoughts or behaviors, and just a few questions can really help kids find the people they need before it's too late. This Columbia Suicide Severity Rating Scale has been implemented in school systems very successfully on a national level and an international level, where you can ask as few as 2 to 6 questions that will identify youth who are at risk of suicide and provides triage points for follow-up. Anyone can be trained in doing this, but the districts that I've seen do this really well have standardized this as part of their school mental health system. When a teacher comes to the counselor and says, I'm a little bit worried about this kid, can you talk to him? Or you have a kid who maybe has had some experiences with acute mental health needs, and so you want to make sure that they are safe to be in your building. And so the questions are simple. Have you ever wished you were dead or wish you could go to sleep and not wake up? Have you ever had any thoughts about killing yourself? Have you thought about how to do this, the intention of acting on them? Have you worked out a plan or started to do anything? And the Columbia Suicide Severity Rating Scale also has some really nice triage points for schools. So possible responses could be behavioral health referrals within the building or in the community or to a crisis intervention system. If a kid is scoring high on 4 and 5, maybe safety precautions and maybe a psychiatric evaluation by a mobile crisis would be indicated. Or maybe we need to think about whether an emergency room visit is needed. And so this can be a really useful tool when you're considering what do we do with this kid who's presenting to us. This tool will be posted on our resources site. We know that this can create a comprehensive, tight network of support and communication, and also that these simple language questions can link our systems with a common language of assessment and evaluation. Last but not least, in my last 2 minutes, for targeted screening tools, we also might think about utilizing screeners to inform groups that we're developing at school. So an example, if we want to start a returning to school following COVID-19 group, you might think of the UCLA brief COVID-19 screen for child and adolescent PTSD, which is a newly developed and evidence-based tool to facilitate risk screening. It's not diagnostic, it's risk screening, and helps you triage around how do we support these kids. It can help with recruitment. It can help talking with parents about the needs that the kids have. And other tools can be utilized in a similar way to support, like referrals to an anxiety group or a depression group or a coping or a resilience group. Last but not least, you need to have a follow-up process with a tiered approach with follow-up with parents and a resource map of schools and communities supports and services. There are resources on our website for community supports and services that are accessible. And maybe Corey, you can put that resource link in the chat. But Dr. Stiles will be talking about following up with parents next time we meet. And then you'll want to think about when do you follow up. For example, if a kid is scoring high in the Columbia, you'll want to follow up the same day. Moderate risk within a week and low risk, you want to have like a reasonable time frame. And have an ability to process this with caregivers and school staff. And if this is something you're implementing, collaborate with your local community mental health providers and think about whether they may need to be on call. And these are just some examples of how to follow up, which we'll talk about a little bit more next time. With follow-up scripts for parent notification, psychoeducational resources, and exemplars of how you could tailor a community resource map to be parent-friendly and easier to view and navigate than some of the large books that we have available. At the back end of this training, which will be disseminated on our website and via email, you'll see highlighted resources and quality guides for